Hello, my name is Brenda Brown, and I will be reviewing the article assigned to me by my preceptor. It is entitled, Burden of Clostridium difficile Infection in the United States. C. diff is due to inflammation of the colon that's caused by the bacteria Clostridium difficile. It's very common. There's over 500,000 individuals that are infected with the bacteria. This article was basically assessing the prevalence of the infection. It was funded by the Center for Disease Control and Prevention, CDC. The research was conducted by several medical doctors and public health professionals. Little background. C. difficile has been around for quite some time. Some individuals decided to conduct some research on the evolvement of the disease, and the research was conducted using active population-based cohort studies and laboratory-based surveillance methods. A laboratory study is done by conducting research in a laboratory, of course, using special equipment to find effective treatments. Disease surveillance, which they used in this study, is essential for guiding the public health response to infectious diseases. It allows for early detection and allows them to implement preventative measures. Population-based surveillance, it allows us to obtain public health data, and this allows us to better get an idea of the burden that it puts on a population. The study was conducted across the U.S. There were about 10 different EIP sites. EIP stands for Emerging Infectious Programs. It spanned across about 34 different countries and 10 different states. I have them listed on the document on the screen. Some of the states included California, Colorado, Connecticut, Georgia, Maryland, Minnesota, New Mexico, New York, Oregon, and Tennessee. This study was approved by the institutional review boards at the CDC and at the participating EIP sites. The inclusion criteria included that the patient be at least 1 year of age, live in the area, in the surveillance area, and they must be a resident of that area. They had to have a positive result on the Clostridium difficile toxin or molecular assay of a stool specimen, and they also could not have a prior positive assay within the past 8 weeks. The exclusion criteria is basically anything outside of the exclusion criteria. And like I said, the only one specifically mentioned was that they couldn't be under the age of 1. The study was basically looking at the number of recurrent infections and the disease and the deaths that occurred within about 30 days of the infection. The information was basically gathered over the span of a year, and the arms of the study was just the basic standard of care drugs to treat Clostridium difficile. The study really didn't focus that in depth about the treatments. So basically, Clostridium difficile infections, they have occurred since the emergence of the North American pulsed field gel electrophoresis type 1 strand. And that has been responsible for the bulk of the hospital-associated outbreaks. And hospitalizations for C. difficile infection among the patient population that is not pregnant has doubled from the year 2000 through the year 2010, and that number is projected to continue to increase as time progresses. Laboratories are transitioning into more sensitive tests, such as the NAAT test, and that stands for the nucleic acid amplification test. And I'll talk more about that a little later. C. difficile, it's very common, as I said before. They've estimated for the healthcare related costs to be as high as $4.8 billion, and that is just for the acute care facilities alone. In this study, a convenient sample of the clinical laboratories across the various IP sites they all had to submit positive stool samples from the cases in order for a full medical review to be conducted on the culture, and then the different isolates that were recovered, they had to undergo this test called pulsed field gel electrophoresis that I talked about earlier, and those patterns were analyzed with the use of a special software called bionumeric software. And then after they did that, they kind of grouped them into different groups based on that test, and they were identified by using the NAAT test that I talked about before. And they calculated the total national burden of C. difficile infection, and they did that by adding the estimated numbers of the community associated and the healthcare associated cases. They came up with 95% confidence interval. And then they estimated that the numbers of occurrences and deaths within 30 days also corresponded to that 95% confidence interval. And it basically accounted for the sampling across the different sites and using site-specific and national sampling weights for the national projection. It has been identified that 15,461 cases they found 15,461 cases across the population that they conducted the study over, and 65.8% were healthcare related, and 24.2% occurred in the hospital. There was approximately 29,000 deaths in the United States in 2011. And that was based on the study that they conducted. As you can see, primary endpoint, like I said, was the first reoccurrences and the estimated number of deaths. The adverse events, they didn't really go into detail other than, severe forms of the infection and the adverse events related to the different treatment. As far as the author's conclusion, like I was saying, estimated 83,000 patients with the infection had at least one reoccurrence, and then approximately 29,000 people died within 30 days of the initial diagnosis. Some strengths of the study: it was conducted over a large population pool, over a vast area. Like I said, they did about 10 different states, and within those states there were different urban areas. So I think that was a good point, as well as it was very detailed and descriptive. Some of the weaknesses I found was it just didn't go in detail with the treatment, and it included information, if the patient was compliant and that type of thing. In summary, this study was funded by the CDC to examine the prevalence of C. difficile infections in a broad range of the United States population. The study conducted that the infection is not exclusively restricted to an acute healthcare setting. C. difficile infections were found to be more prominent in Caucasians, females, and individuals over the age of 65. The infection can be acquired through the community setting. and they do see in the future for more research that is geared toward prevention protocols and appropriate antibiotic treatments. In conclusion, I think the basis of this study was very good. It was well conducted, and I agree that more research should be done to conduct information based on the proper treatment and prevention methods. And that completes my journal club critique. Thank you for watching. Bye.